Thank you, Senator Collins, for holding this very important hearing. It is incredibly sad to see what's happening in our nursing homes and our assisted livings, going on with our caregivers across our country. I was a caregiver for my parents and in-laws. I understand this from a firsthand perspective, and it is overwhelming, frightening, and frustrating, particularly at this time. But one thing that I think we really need to focus on is research. Research to fully understand how this virus works and how to best treat and prevent it. It's so critical. I recently introduced legislation with Senator Rubio, the Ensuring Understanding of COVID-19 to Protect Public Health Act. It's going to require a longitudinal study of COVID-19, including individuals of all ages, along with diversity in race, ethnicity, gender, geography, underlying health conditions. We need to understand why the virus impacts some people, like our seniors, differently than others. We need to understand what the presence of antibodies really means, if seniors or others who get sick gain an immune response or not. You know, that's the theory, that they gain an immune response, but reports of groups of patients becoming ill a second time is really concerning. And there's been recent reports, of course, across the group of sailors on the USS Theodore Roosevelt getting reinfected. So, Dr. Mulligan, I have a two-part question. Do you know what the latest research is, or can you talk about it, the latest research that's following patients who are diagnosed a second time with coronavirus, including seniors, because this could have a further impact on our senior living centers? Do we know if this is a brand new infection or if it's the original infection making them sick again? And what do you think this information might have? What impact might it have on vaccine development?
Thank you, Senator Rosen, for this question. I do think that the jury is out in terms of formal proof that having recovered successfully, one is immune. Certainly, most people that recover make antibodies. We've seen that in our own studies, and many others have reported that. With most viral infections, it's true that once you've had it, you are protected, at least for a period of time. I personally expect that that should be true here as well. The formal proof of that will be done in studies such as you described, and I think that's a fantastic study. We're entering a time point where we have more and more convalescent patients, and now we can study how they do over time. I think that the jury's out on these reports of possible reinfections that may well represent an intermittent negative test and then a positive test that occurred as a result of their original infection. We know that can occur. The test is not perfect, and so that wouldn't surprise me if that was the cause of some of those. But the jury's out, and for vaccine development, it's the same. I'm a scientist. I want to know what the evidence says. If we do our studies correctly, if we're well supported, we will get the truth. We will get the answer, and that's what science will do for us.
Well, I want you to also, in your testimony, you said that medical countermeasures may need to be tailored to seniors in order to optimally protect them. Could you expand on that a little bit in the minute or so that I have left, please? Give us some good examples.
Sure, I'm very happy to do that. Maybe the most prominent example is that we have a couple of special vaccines for flu for seniors. We have a high-dose vaccine. We have a vaccine with adjuvant. We know, as I said, seniors' immune systems are weaker and they don't respond as well to vaccines. And so having a stronger vaccine, one with an adjuvant, one with a higher dose, may be necessary for COVID-19 in seniors as well. So we need to do those kinds of special studies. We also want to be sure that treatments are tolerated well and are safe in seniors. Their system is different, and so we need to be sure to include seniors in our treatment studies as well as our vaccine studies. And then another great example is the monoclonal antibody approach. If a senior can't make a nice antibody themselves, perhaps we can infuse the antibody, this monoclonal antibody drug, and that is something that is going to be explored in the nursing home setting, and I think is very important.
Well, I thank you and all the other witnesses for your work, your passion, your commitment. We really need you. We're very thankful you're doing what you're doing, and Please stay well and safe. Thank you.